Hey everybody, this is a short sequence for active mobilization, primarily for the shoulders. You don't need much. If you're comfortable seated on your shins, go for it, you're good to go. I'm stacked up on 2 blocks underneath my booty. We'll start with cervical cars. I like to take the right arm underneath the left arm, give yourself a big, huge hug, get a tight grip, let your shoulders soften down. Bring your chin to your sternum, so flex your cervical spine, and keep the tuck of your chin down. Imagine you had a marker on your chin, and slowly draw a line along your right collarbone, all the way towards your shoulder head. Go as far as you can to the right, and stay turned, but start to draw the line up towards the ceiling now. So your head tilts up into extension and rotation. And then start to rotate to the middle. So look straight up towards the ceiling and continue going over towards your left. And then stay off to the left and start to bring your chin down towards the top of your collarbone. And then graze along your collarbone all the way back to the center. We'll keep going to the right. Bring your chin to your right shoulder. Keep it off to the side, bring your chin all the way up towards the ceiling, tilt your head up. Start to turn towards the left. Keep going, go all the way over to the left towards your shoulder. And then tuck your chin down, it's still on the angle, and then you bring it to your sternum. Let's go the other way. Actually, let's undo our arms for a second. Shake out the arms, my arm is starting to burn. And then bring your left arm underneath your right arm. Give yourself a nice tight grip and let your shoulders soften. And then tuck your chin to your sternum. Keep it tucked. And start to slide your chin along your left collarbone to your left shoulder head. Go as far as you can, rotate as much as you can, as long as it doesn't hurt. And then draw a line up towards the ceiling. So you're still rotating, but you're lifting up into extension, and then start to rotate all the way over towards the right. Stay off to the right, start to flex your neck in rotation, bring it towards your shoulder head, to your right collarbone, and then to your sternum. One more time, to the left. Stay left, go up. Stay up, go right. Stay right, go down. Stay down, find the center. And then, so that was cervical cars, controlled articular rotation. We'll do thoracic cars. So it's very, very similar with a little bit more of, just the way that I'm teaching it, a little bit more of a cue of side bending when we go there. So for this one, I like to cross at the wrists, get strong in your arms, plug yourself into the blocks underneath you or into your shins if you're sitting on your shins, and round your back. So engage your belly and flex your spine. Keep rounding your spine and actively turn to your right. So I like to say, turn your left ribs to your right ribs. And then keep the twist, but bring your right shoulder to your right hip. So you add that side bend. And then keep side bending and start to lean back. Lift your heart towards the ceiling. And then pull your heart straight up towards the ceiling above you. So now you're neutral in the back bend. Now, while you're back here, start to turn towards your left. So twist your right ribs to your left ribs. And then bring your left shoulder to your left hip and side bend. And then round to the middle. Flex your spine. Stay rounded, twist to your right. Stay twisted, side bend. Bring your right shoulder to your right hip. And then keep that and start to lean back so your heart goes straight up towards the ceiling. Find the center, back bend, neutral. Now twist towards your left while you're back there. And then side bend. Bring your left shoulder to your left hip and round to the middle. We'll do that on the other side, but let's cross the wrist the other way, just for my own OCD. Round your spine if you're not already. Twist towards your left. Keep twisting, side bend. Bring your left shoulder to your left hip. Start to back bend, and then you circle to the center. And you stay back there as you twist towards your right. Bring your right shoulder to your right hip, side bend, and round to the middle. Let's keep going. Twist to the left. Left shoulder, left hip. Keep side bending, but start to initiate the back bend. Find a neutral back bend. Twist towards your left. Towards your right. Bring your right shoulder to your right hip, side bend, and then round to the middle. Boom. Okay, next stop, scapular cars. I really like the cueing of having the arms out in front and imagining that your fists are stuck on two shelves. So they don't go up and down. They don't go up and down. The movements of the scapula are elevation, depression, protraction, which is bringing your shoulders forward, and then retraction, which is bringing your shoulder blades together. So when you have your fists out in the air, let's do it. Take your fists, place them on two shelves. They'll eventually come in and they'll eventually go forward in protraction and retraction, but don't let them go down when you elevate and you depress, because then you're adding the humerus, too much of the humerus. So keep your fists right where they are. And we'll start with elevating the shoulders. So bring your shoulders up to your ears. Notice if your fists follow. Keep your fists on those two shelves. Keep your shoulders elevated and protract your shoulders. So pull your shoulder blades apart. Your fists should go forward in space. Now keep your fists right where they are and depress your shoulders. Bring them down towards the floor. And then retract. Bring your shoulder blades together. Notice if your ribs are just flaring out. Engage your belly if that's you. Keep your shoulder blades together. Keep your fists where they are. And elevate your shoulders. Bring them right up to your ears. And then bring your shoulders forward. Protraction. Keep your fists where they are and depress your shoulders. Okay, so let's keep them forward and elevate. Keep them elevated and retract. So now we're going the other way. So bring your shoulder blades together, firm your belly, don't let your ribs flare out. Keep your fists where they are, depress your shoulders, bring them down. Keep them down, bring them forward. Keep them forward, bring your shoulders up as far as they go. Bring your shoulder blades together, keep them up, 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 and then keep them back there and bring them down. Keep them down, bring them forward. Bam, scapular cars. Let's do one more set of controlled articular rotations. We'll do the glenohumeral joint. So the movement of the arms are external rotation and internal rotation, flexion, extension, abduction and adduction, but that kind of happens on its own. Okay. Make a strong fist out of your right hand and take your left hand and just place it on your chest. Firm your belly and press your fist and your chest together, just as a nice piece of feedback, and put tension into your right arm. Engage your bicep in a long position. And then start to cross your arm over towards the left, so that's adduction. So you cross it across your face, and then start to bring your arm up towards the ceiling. Turn your bicep, your armpit, outwards. So your fingernails will go out to the right, but it's actually happening from your bicep and your armpit. So that's called external rotation, internal rotation, my bad. And then keep internal rotation and start to bring your arm back behind you and pause for a second. And notice that you can internally rotate your arm even more, and you can probably extend the arm by bringing it back a little bit more. And then keep going, reach your arm back, back, back. Increase the internal rotation of the arm consistently the whole time. And then again, let your arm go to your side. Then reach your arm straight back behind you. Notice if you're letting your ribs collapse out, firm your belly. Go a little bit further than you think you can. And also hug your arm towards the left a bit. Hug it to the midline. And then start to externally rotate your arm. So turn your fingernails up, but it's really turning your bicep up. Remember the armpit thing. And as you go back up, think of reaching your arm back behind you as you go up. Back behind you as you go up. Back behind you as you go up. And then as you come forward, you cross the midline. You adduct your arm. And then you bring the arm down next to your body. Let's do 2. Bring your arm off to the left. Adduct. Cross your face. Bring your arm up. Internally rotate your arm, which is turning your bicep forward, and then start to reach your arm back behind you and increase the internal rotation as you reach back for the space behind you, back towards the space behind you, and eventually your arm lands to your side. Going a little faster, so go arm back, externally rotate your arm, keep your arm externally rotated, and as you come up, you're seeking for the biggest circle as you can. As you go forward, you're finding adduction, so you cross your arm along the midline. Okay. Do the other arm. Take your right hand to your chest, make a fist, do whatever you want. But basically the whole axial skeleton, your spine, your ribs, they're not moving at all. You only have a shoulder. Make a strong fist out of your left hand. Put tension into your left arm. Don't move your back. Start to cross your arm over towards the right. Bring it into flexion. Internal rotation. So turn your bicep out towards the left. And then you're trying to create the biggest, dopest circle as you can. So we pause on the first one, so let's pause here, pause. Notice that you can probably internally rotate your arm more, and you can probably sneak it back even further. And then keep reaching, seeking the back wall as you reach back. As you reach back, increase the internal rotation, and eventually you will have your arm by your side. And then reach your arm straight back behind you, and pause. Hug it to the right. Lift it a little higher than you think you can, and then keep that and externally rotate your arm. Spin your bicep up and start to reach your arm back and up, back and up, back and up, back and up. Remember, as you come up, you cross the midline. As your arm goes forward, you cross your arm along your face, and then you find your side body with your arm. Let's do one more, a little bit faster, a little bit more fluid. Cross your arm towards the midline, adduct. Find flexion, and as you do, internally rotate your arm, bicep out. Keep internally rotating as you reach your arm back behind you. Increase the internal rotation, seek the back wall with your arm, and then find the side body. Reach your arm straight back behind you. Pause, externally rotate your arm. Keep externally rotating, reach your arm back up towards the ceiling. Cross your face, adduct, and then let your arm go to your side. Okay, let's go on our side. So you go ahead and go onto your left side. I like to, if you have blocks, I like to use them as pillows, and I like a pillow in between my thighs. So if you got blocks, use them, or don't. And we'll do pails, rails of the glenohumeral joint and internal rotation. So put yourself on your side and scoot your butt back in space. Don't overthink it, just scoot your butt back in space. It will clear your arm from your stomach and from your chest. And just kind of tuck yourself underneath the left shoulder, just a little baby bit. So you're on the back of the shoulder, you can feel a little bit of your scapula on the ground. And bring your fist, bend your left elbow, and bring your fist a little bit closer to your body. And then take your top hand, your right hand, and place it on top of where your wristwatch would be, right on the very tip of your forearm, and just let the arm passively mobilize your arm in internal rotation. So you don't have to press down. I mean, you could for a second to see how it feels, but that's not how you're meant to do this. It's just a nice passive weight for your arm, and it's bringing you into internal rotation. And if you're doing that too much, and your shoulder, your left shoulder is coming off the ground, then you wanna fix that up. So we do this for around 2 minutes, and what we're doing in this position is basically we're passively mobilizing, as I said, the arm, the glenohumeral joint in internal rotation. And you might not feel a big, huge stretch in what's called your posterior capsule. That's what you're stretching, the deepest stuff, pretty much in your shoulder. You might not feel a big stretch, but trust me, you're stretching. It's the deeper stuff, you don't feel it as acutely. But what you're doing primarily, and more importantly, is you are waking up what are called fibroblasts, which are basically precursor cells that are waiting for a signal from your body. And your brain doesn't really get too much of a signal from your peripheral nervous system until about 2 minutes of a stretch. So that's why we hold it for this amount of time. You hold it for around 90 seconds to 2 minutes. Apparently that's the scientific magic number. And that's when your fibroblasts kind of wake up, and your central nervous system that receives information starts to pay attention and says, okay, like, what's going on down there? You've been holding that stretch for a while. And at that point, that's when the fibroblasts wake up, and eventually in like 30 seconds, we'll start to activate this. And we will start to strengthen the muscles in long positions and short positions. And that's actually how you pick up more range of motion. Not just by stretching, which I've kind of debunked in a previous video, but by actively mobilizing in longer and shorter ranges. So the tissue on the back of the shoulder right now, the posterior capsule, that's on a stretch. We're gonna lighten that up and start to activate the stretch. So don't do it yet, not quite yet. The action that I'm gonna ask you to do is try to externally rotate your arm, but that's not gonna actually happen because your hand's gonna be there. So it's gonna stay on a stretch, but it's gonna become an active stretch. We're gonna ramp up for a certain amount of effort, up to 100% of our effort, if that feels good in your body. And we're gonna hold that for 10 seconds. Now, when we're finished, we're gonna do the opposite, and we're gonna try and like arm wrestle someone down, and we're gonna activate the tissue in a short position, if that makes sense. Okay, so let's do this. I said that was a lot of talking, but I had to waste time in some respect. So you're stuck in internal rotation, don't let the top hand move. Start to press your wrist back up into your hand just a little bit. So I'm gonna start counting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10% of your effort. So we're ramping up 1 percentage point at a time, and you're gonna ramp up another 10%. 1, 2, 3, 4, 5, 6, 9, now you're at 20%, and so on. So 1 percentage point at a time, don't give it all up at once. 1, 2, 3, 4, 5, 6, 9, 30. 1, 2, 3, 4, 5, 6, 9, 40. 1, 2, 3, 4, 5, 6, 9, 50, getting a little harder. 1, 2, 3, 4, 5, 6, 9, 60. 1, 2, 3, 4, 5, 6, 9, 70. 1, 2, 3, 4, 5, 6, 9, 80. 1, 2, 3, 4, 5, 6, 9, 90% of your effort. 1, 2, 3, 4, 5, 6, 9, 100% of your effort for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then pause. And now you're gonna escape your wristwatch, where your wristwatch would be away from your hand. So you no longer, once you activate that stuff, you no longer need your top hand. So what I like to do is take the top hand to the shoulder and kind of press it down so it doesn't go anywhere, and also roll onto your back just a tiny bit. So turn your chest up a bit, and then we're gonna slowly, incrementally start to push the wrist towards the floor. It'll be a strange sensation, especially if you've never done that. You're gonna go into a range of motion that you're not used to being in, and so it's always neurologically effed up. So start to bring your wrist, like you could, closer to the floor for 10. 1, 2, 3, 4, 5, 6, 9, 20. Notice my wrist isn't going anywhere because I'm at my end range. 1, 2, 3, 4, 5, 6, 9, 30. 1, 2, 3, 4, 5, 6, 9, 40. 1, 2, 3, 4, 5, 6, 9, 50. 1, 2, 3, 4, 5, 6, 9, 60. 1, 2, 3, 4, 5, 6, 9, 70. 1, 2, 3, 4, 5, 6, 9, 80. 1, 2, 3, 4, 5, 6, 9, 90. 1, 2, 3, 4, 5, 6, 9, 100% of your effort, your safest, greatest effort for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay. So you go on your right side now, your other side, whatever you're on, it doesn't matter. Be on your side, scoot your butt back to get the arm and the chest out of the way of themselves. And then bend your elbow, the bottom elbow, and bring the fist a little closer to your body. I say that because most of the time when we do this, the arm actually escapes us, which actually doesn't internally rotate the arm as much. So bring your fist a little bit closer, take your top hand and place it on where your wristwatch would be, and let the arm just mobilize down. So for me, I have so much more internal rotation on this side. So I know I'm saying a lot, and it can be confusing. So remember that there's kind of 3 steps to this. This is called pails rails. It's from functional range conditioning. And what we're trying to do is strengthen the musculature, or really just the tissue that internally rotates the glenohumeral joint. That's some of the deepest stuff, or the deepest stuff that you have in your glenohumeral joint. And stretching in and of itself doesn't really make any long-lasting structural change, but activating in stretched out positions and activating in very short positions absolutely does. So some people use the terminology eccentric and concentric contractions. It's not like totally accurate because technically we're doing an isometric contraction. There's no movement, but we're working at our end range, the long ranges and the short ranges. And remember that what happens is you wake up the tissues, you wake up literally the cells in your body. You start to create an efferent and an efferent, an efferent and an afferent message between the central nervous system and the peripheral nervous system. And so you're basically creating like a mind-body connection. And I always say that, to waste time, I'm talking your ear off. Remember, we're supposed to do this for 2 minutes. I always say that the central nervous system is like the CEO, and it only wants to hear, you know, the most prevalent, important information. And that information is not important until about the 2-minute mark. And fibroblasts turn into the cells that make you up. So tenocytes turn into tendon, and desmocytes turn into ligament and capsule, and myosin and actin turn into muscle, and all this stuff. You're basically just trillions and trillions of cells, and you actually, through your movements, conduct those cells and tell them what to do. So let's tell them what to do. So keep your top hand from moving. Remember, you're trying to do this, but you can't because the top hand is there. Start to press the back of your hand, the back of your wrist, into the top hand. Press harder at 10%. 1, 2, 3, 4, 5, 6, 9, 20%. Press harder still. 1, 2, 3, 4, 5, 6, 9, 30%. Harder still. 1, 2, 3, 4, 5, 6, 9, 40. 1, 2, 3, 4, 5, 6, 9, 50. 1, 2, 3, 4, 5, 6, 9, 60. 1, 2, 3, 4, 5, 6, 9, 70. 1, 2, 3, 4, 5, 6, 9, 80. 1, 2, 3, 4, 5, 6, 9, 90. 1, 2, 3, 4, 5, 6, 9, 100% of your effort. That's a lot of effort for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And then pause. And now you're trying to escape your top hand. And maybe you won't, and that's totally fine. It means you're doing it well. I like to take my top hand onto my shoulder head so it doesn't move. And then just let your chest turn up a little bit. So you really want your shoulder head to pin into the ground. You don't want to let that guy come off. Okay, then start to drive where your wristwatch would be towards the floor. You're increasing the internal rotation of your glenohumeral joint. 10. 1, 2, 3, 4, 5, 6, 9. Ramping up your effort. 20. 1, 2, 3, 4, 5, 6, 9, 30. 1, 2, 3, 4, 5, 6, 9, 40. 1, 2, 3, 4, 5, 6, 9, 50. 1, 2, 3, 4, 5, 6, 9, 60. 1, 2, 3, 4, 5, 6, 9, 70. 1, 2, 3, 4, 5, 6, 9, 80. 1, 2, 3, 4, 5, 6, 9, 90. 1, 2, 3, 4, 5, 6, 9, 100. 100% of your effort. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. So if that sucked, you're doing it well. And if it was frustrating and weird and you're kind of like WTF, then give that a whirl a little bit on your own, or watch this video a few more times, and you will get it. Like, you'll get the terminology too. It's a lot to take in, but trust me, it works. I'm gonna lose my blocks. I'll lose the blocks. Lie down on your stomach, and we'll put all this together, and then we are done like dinner. You'll take your arms off towards the sides of the room. So make a T out of your arms. And just so that it gives you a semblance of direction, make a fist out of your hands and let your thumbs go. And then, like 2 thumbs up, turn your thumbs up towards the ceiling. You could have your head floating. You could actually take your forehead on one of those blocks if you want to. I like to have my head floating. So bring your tailbone into the floor, which is very important. Keep your tailbone driving down and retract your shoulder blades. You've already done that. Bring your shoulder blades together. And then keep that sets the scapula, and lift your arms slowly up into the air as high as they go. Notice if you're back bending, especially in your low back, drive your tailbone into the ground. We tend to use too much of the mid back, the low back here. Use the top back only. And remember, turn your biceps forward. Turn your armpits forward. Now go a little higher than you think you can, and stay that high, and just flutter your arms up and down. Like you're a dragonfly or something like that, like you've got wings. And let's do this for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Pause. Turn your thumbs forward. Turn your thumbs down. And then turn your thumbs all the way back towards your feet. So you basically just went into internal rotation. Now get your arms a little higher because I bet you they sunk. And keep your arms that high and turn your thumbs down again. And turn your thumbs forward again and turn your thumbs all the way up again. Keep your arms nice and high and turn your thumbs forward. Start to internally rotate down towards the space behind you. Max out your internal rotation. And then turn your thumbs down, turn your thumbs forward, turn your thumbs up. Let's do one more. Remember, you're wrapping from your upper arms. Get your arms a little higher, turn your thumbs forward, turn your thumbs down, turn your thumbs back. Upper arms rotate back. Get the arms a little higher, turn your thumbs down, turn your thumbs forward, turn your thumbs up. Wrap your armpits forward and then take a little break. Whew. Let's just take our head on our forearms. So I'm going to change my angle. You don't have to, just so maybe that you catch a different angle. So we'll go into a Y position now, and that's going to be more of a pain in the ass for most of us because things get harder as you go towards shoulder flexion. So bring your arms into a Y position. So they were in a T position before, reach them a little bit further forward. And then move your tailbone down into the ground. Bring your shoulder blades together on your back, set your scapula. And now do this slowly, it's pretty important, do it slowly. Start to reach your arms up towards the ceiling. Push past where you think you can go. And can you wrap your arms into external rotation anymore? Now, as you're up there, flutter your arms. Up, up, up. And we'll do it for 10. 9, 8, 7, 6, 5, 4, 3, 2, pause. Turn your thumbs towards each other. Turn your thumbs down. Turn your thumbs back. Internally rotate your arms. Keep your arms higher. And then turn your thumbs towards each other and turn your thumbs up. Let's do it a little quicker. Up and then down and back. Max it out. Down, towards each other, up. One more, towards each other, down and back. And then towards each other, up and take a break. Oh. Okay, so I've started to sweat now. So a PT will do T's, Y's, and I's. So we'll go towards I's harder. So we're just gonna do it one arm at a time. For my own sake, really. So if you bring your arms forward into an I position, like your body was drawn into an I, dig your tailbone into the floor, retract your shoulder blades a little bit, and this time push your left arm into the ground and reach your right arm up towards the ceiling. So flex your shoulder. And then turn your thumb to the left and turn your thumb down. Turn your thumb to the left and turn your thumb up. 2 more. Keep the arm nice and high, turn your thumb to the left and turn it down. Internally rotate your arm. Remember, the armpit's the thing that's doing it. Turn your thumb to the left and turn it up. Turn your thumb to the left and turn it down. Turn your thumb to the left and turn it up, and then get it higher and do 10 pulses. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. You thought I forgot, didn't you? The pulses, and I did forget. I just did it in a different order, but that's good. So, one more like this. Dig your tailbone into the floor, bring your shoulder blades together on your back, and push your right fist into the ground. It'll help a lot. It'll give you more power. Hover your left arm off the ground as high as it goes. And then turn your thumb to the right and turn it down. Turn it to the right and turn it up. Can you spin from your upper arm? Remember, the thumb is just the direction piece. Turn your thumb to the right, turn it down, spin your bicep, spin your armpit, turn it to the right, and turn it up. One more time. To the right, down. To the right, up. And then keep it as high as you can. Get a little higher, and 10 pulses. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Take a break. So we've done internal rotate in this position, in a prone position, internal rotation, external rotation. We've done horizontal abduction. What else have we done? Flexion, bunch of flexion. So it stands to reason that we should do a little bit of extension of the shoulders. So if you're a yogi, think baby cobra, but do baby cobra position with fists. So where your rings would be, take that on the ground. Don't worry about the thumbs. Move your tailbone into the ground. Bring your shoulder blades together. So retract your shoulders. You should feel that they lift away from the ground. And then I always say that imagine you traced a line around your fists and you want to hover your fists right up off that line. Like there's an imprint in the floor from that line from your fists. So your fists don't go forward, they don't go back, they just hover right where they were. And then hug your elbows closer together and try and get your elbows higher, lift them up. Now keep your elbows right where they are and start to extend your arms back behind you. Try and lift them as high as you can, max that out, and keep that as you hug your wrists towards one another. Hug your wrists, you should feel your triceps burning. And then keep your elbows this high and start to bend your elbows, hover your wrists, try and find the imprint, and place them back down. Whew! Tailbone down. Just during the pause, during the break, we reset. Tailbone down. Bring your shoulder blades together. Hover your fists off the ground. Keep your elbows right where they are. Extend your elbows, straighten your arms. Now get your arms as high as you can and hug your wrists towards each other, maximally. Keep your elbows where they are, bend them, and place your fists down on those imprints. We'll do one more. Things happen in 3. Move your tailbone down. Bring your shoulder blades together. Hug your elbows together and hover your fists off the ground. A drip of sweat just fell off my brow. Reach your arms back behind you. Max that out. Bring your arms as high as you can. And then pull your wrists towards each other. You got this. Come on. Pull, 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 pull. Keep your elbows that high. And then bend your elbows. Place them down to the floor. And take a break. We got one more thing that we're going to do only 2 sets of. Because this is all I got left. That's all I got. We'll put all of that stuff together. Okay. Let's do it. So you bring your arms forward. You make an I. We're going to go all the way back and make a T. When we're back here, we'll bend the elbow. And I'm going to try and tell you to try to not touch your t-shirt with your hands. So you'll go extension and elbow flexion. Okay? You'll see. Woo! Thumbs up, fists. 2 more rounds of something. Move your tailbone down into the floor. Bring your shoulder blades together on your back. Hover your fists up as high as you can. And then start to reach your arms off to the side. And notice, pause for a second, you can reach your arms higher. So as you go off to the side into the T, reach your arms higher, higher, higher. Now pause in the T and internally rotate your arms. Turn your thumbs all the way back. And as you reach your arms back behind you, all the way back, lift them up, 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 up. And just like we did, hug your arms as close towards one another as you can. Now keep your arms like that, but bend your elbows and fist bump your hands back behind your spine. Don't touch your t-shirt, but fist bump. And try and get your knuckles as high as you can up your back. Don't touch your t-shirt. Keep the position of your arms, but rest everything down for a second. Just to reset, move your tailbone down into the floor. Bring your shoulder blades together on your back so your shoulder heads lift. Squeeze your fists together, and there's magic to this action right here. Just do the action of hovering the back of your hands off of your spine. Hold that for a second. Keep your elbows from moving, but straighten your arms back behind you. Hug your arms together strongly. And then as you bring your arms off to the sides, turn your thumbs forward, turn your thumbs up. Keep going forward. Try and keep your arms this high. Keep them up, up, up as you bring your arms all the way forward into the I position, and then bring your arms down. Okay, we'll do one more and we'll make it smooth. Tailbone down. Shoulder blades together. Let's do this last round of stuff. Arms up towards the ceiling. Start to reach your arms off to the side. Notice you can reach your arms higher, higher, higher. As you go to the T position, start to internally rotate your arms. Thumbs down, thumbs back. Reach your arms back behind you. Reach them up, 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 up. Hold it for a second. Hug them together. Start to bend your elbows and fist bump. Don't touch your t-shirt. Try and get as high as you can up to the scapula, and then let everything rest down. Just the way back. Move your tailbone down. Bring your shoulder blades together. Squeeze your fists together and hover your hands off of your back. Keep your arms nice and hugged together. Reach your arms back behind you. Get them as high as you can. Start to reach your arms off to the side and externally rotate your arms, thumbs up eventually. Now try and keep your arms nice and high as you bring your arms all the way forward and place them down. Drenched in sweat. So all done. Thank you for your effort. If you actually made it through that whole video. I know that stuff is very, very hard, but if you want to pick up more mobility, active strength, usable strength, functional strength, this is the kind of work that has just made such a difference in my practice. You want to basically train all of the tissues in each one of your joints, and you want to find your end range in long positions and short positions, and I'll be offering this kind of work on the regs. So it's quite arduous and difficult and challenging as you do it, but that will actually start to diminish, and you will get better at it, and it will become less so, and it will make a big impact in the way that you move, and whatever that is. If you're a dancer, if you're a yogi, if you're an athlete. Thank you very much.